I told you at the beginning I was going to talk a little bit about the practice growth paradox. This is the new data, new study that we've come out with. And we've gone through and analyzed a bunch of our practices. And we're finding that based around the money funnel and the benchmarks and averages, in an average practice, and let's use a 10 to 20 new patient per month as an example, they're also missing out on 7 to 18 additional new patients because of their money funnel that they don't even realize they're not getting. And I go in a lot of practices. I have friends that are dentists. There's nothing more frustrating for a dentist to show up at work every day and feel like there's some kind of invisible ceiling on production and success that they just can't seem to punch through. We call this the practice growth paradox. And it's a paradox because even though your practice has grown to be a success, it just doesn't feel that way some days. And, when you have a successful practice, there's an upward momentum that exists when it comes to your expenses and your personal lifestyle. And the reality is those two things are rising. Sometimes they rise slowly. Sometimes they don't. Sometimes they rise very quickly. But lifestyle and expenses are always going up for everybody. Today is the cheapest day it's ever going to be. A plateaued practice ends up feeling like you're stuck in a basement that's filling up with water and you can't get out. And the expenses keep rising and that upward pressure keeps pushing down on your profit margins. And there's only so much time before the water fills up. So this practice growth paradox is I think it's around a 12-page analysis that we put together around this paradox that we see it. The paradox of always being busy is what I open this up with saying. Busy versus productive. The power of compound interest in your practice. Part of this is going to be talking about the money funnel. There is a stat that we have surveyed that 91% of dentists don't know. I'm not going to tell you what it is, but on page 4, I go into more detail around this one stat that's critical, a critical element, a dashboard that every practice should have. 91% of the clients that we've brought on don't have it or don't know what it is. Page 5, I go into more detail around why most team training doesn't work. A lot of team training ends up in lack of success or lack of results to show for the success. And then on page 6 through 8, I'm going to go through our 4-part framework. And you're going to learn about how we look at things and how to overcome these paradoxes in your practice. 2020 is going to be a year of change for dentists. 2020, I'm projecting, is going to be the year that we look back and say, dentists stopped working in their practice 24/7, like I know a lot of dentists do. I mean, it's consuming. Doing the clinical side and running the business and wearing all the different hats can be consuming. And 2020, as painful as this coronavirus has been, I'm going to go ahead and predict that this is going to be the year that the systems and processes and people get installed in your practice so that you don't have to run around like a madman anymore. And you're going to start working on your practice. 3 or 4 days a week clinical, 1 or 2 days a week business. And often what happens is it turns into what we see in a lot of practices is it's 4, 5, 6 days a week clinical and very little on the practice business side stuff. And that's where you build efficiencies. That's where you build your A players. You build the profit side, and you build the strong foundation that your practice needs.